If you do not know what monkeypox is, it is an uncommon condition known as monkeypox and is brought on by infection with the monkeypox virus. The variola virus, which causes smallpox, and the monkeypox virus are both members of the same viral family. Smallpox symptoms are comparable to those of monkeypox, although they are milder, and monkeypox is rarely fatal according to the CDC. As we get started, kindly subscribe to our channel Health Guide. Make sure to stay till the end, so you don't miss any important information. Here are the symptoms of monkeypox. Monkeypox infections typically begin with flu-like symptoms such as fever, headache, muscle pain and fatigue. Then the pox starts to appear as rash. The rash usually starts on the face and extends to other regions of the body. This includes the mouth, the genitals, and anus. You may also have anal discomfort or bleeding from the bottom. The rash is occasionally mistaken for chickenpox. These rashes can mirror those caused by the virus that causes chickenpox, as well as those caused by sexually transmitted illnesses like syphilis and herpes. Monkeypox rashes develop in phases, beginning with discolored areas of skin and progressing to raised bumps, blisters, and huge, pus-filled pimples that finally scab over and fall off. According to the WHO, in extreme circumstances, individual skin rashes might merge to produce one massive lesion that causes vast quantities of skin to slough off at once. According to the World Health Organization, monkeypox infections can occasionally result in serious consequences such as secondary infections, inflammation of the air sacs in the lungs, an excessive, full-body immune response, inflammation of the brain, and infection of the cornea with resulting loss of eyesight. How to prevent monkeypox transmission. The CDC provides helpful advice to reduce the spread of monkeypox such as 1. Avoid close skin-to-skin contact with patients who have a monkeypox-like rash. 2. Do not touch a monkeypox patient's rashes or scabs. 3. Avoid kissing, hugging, cuddling, or having intercourse with someone who has monkeypox. 4. Share no eating utensils or cups with someone who has monkeypox. 5. Do not handle or touch a person with monkeypox's bedding, towels, or clothing, especially without gloves and a mask on. Another helpful tip is to wash your hands often with soap and water, or an alcohol-based hand sanitizer. Finally, avoid contact with animals that can spread the monkeypox virus, such as rats and primates, and avoid animals that are sick or dead, as well as bedding or other things they have touched. What to do if you have been exposed or are experiencing symptoms. The CDC encourages anyone who has been exposed to a confirmed monkeypox case to monitor their symptoms for 21 days after the exposure. They should keep an eye out for fever, chills, enlarged lymph nodes, and new skin rashes. If any of these symptoms appear, persons should separate themselves and call their healthcare practitioner as well as the local or state health agency for additional instructions. Individuals may then be urged to undergo diagnostic tests, and doctors should determine if they are at risk for serious illness or require hospitalization. The CDC advises persons who test positive for monkeypox but do not need hospitalization to isolate at home and, if possible, keep away from the people or pets they live with until their symptoms subside. This is because it is possible for humans to transmit the virus to some animals. According to Michigan Health, sick individuals should wear a mask while around others to prevent the infection from spreading through respiratory droplets. If you like this video, kindly give us a thumbs up and share it with family and friends. Is there a vaccine for monkeypox? Some people could be eligible for the monkeypox vaccine. The CDC reports that the ACAM 2000 vaccine, which was first created to combat smallpox, is at least 85% effective at preventing monkeypox when given prior to exposure. The Johns Hopkins Bloomberg School of Public Health further states that JYNNOS, a vaccine authorized for both smallpox and monkeypox, is believed to be similarly protective against the virus, based on clinical testing and animal studies. People are considered fully vaccinated about 2 weeks after their second shot of JYNNOS and 4 weeks after receiving ACAM 2000. Visit the CDC website to see if you qualify for the monkeypox vaccine in the United States. Treatments for monkeypox. There are no medications licensed specifically to treat monkeypox, and many patients recover without the need for therapy. In extreme situations, patients may be given antiviral drugs meant to treat other illnesses. Anyone suffering from monkeypox should drink enough fluids, eat healthily, and get plenty of rest. Self-isolating individuals should take care of their mental health by engaging in activities that they find enjoyable and relaxing, while staying in touch with loved ones via technology. And engaging in physical activity if they feel well enough to do, and seeking support for their mental health if necessary. Monkeypox patients should refrain from scratching their rash and take care of it by washing their hands before and after handling the lesions. They should keep their skin dry and cover it with clothing or a bandage until they can isolate again, unless they are unavoidably in a room with another person. Sterilized water or an antiseptic solution can be used to keep the rash clean. Mouth lesions can be treated with salt water rinses, while body lesions can be treated with warm Epsom salt and baking soda baths. Also, pain relief from oral and perianal lesions is possible with lidocaine application. You should see your doctor or seek medical advice from a healthcare practitioner if you develop symptoms or become severe.